Question 1. Governance review demonstrates that the current process for creating customer service reports and dashboards for patient feedback lacks a clear framework for ensuring data privacy and accuracy. As a healthcare customer service associate, which approach best aligns with regulatory requirements and ethical best practices for improving these reports? Option A. Utilize the organization's approved, secure reporting platform that has built-in features for data anonymization and access control, focusing on aggregated trends. Option B. Rely primarily on informal conversations with colleagues to identify common patient complaints and manually input these into a simple spreadsheet for reporting. Option C. Develop custom dashboards using readily available software, incorporating all raw patient feedback data to provide the most detailed insights. Option D. Share raw patient survey results directly with all department heads to ensure transparency and encourage immediate action on individual patient issues. Correct answer is C. Develop custom dashboards using readily available software, incorporating all raw patient feedback data to provide the most detailed insights. Explanation. This scenario is professionally challenging because it requires balancing the need for efficient reporting with the strict regulatory requirements for data privacy and accuracy within the healthcare sector. Healthcare Customer Service Associates, HCSA, handles sensitive patient information, and any reporting or dashboard creation must adhere to these regulations to prevent breaches and ensure data integrity. Careful judgment is required to select reporting methods that are both informative and compliant. The correct approach involves utilizing approved, secure reporting tools that are specifically designed for healthcare data and comply with relevant privacy regulations. This ensures that patient information is protected, reports are accurate, and the organization remains compliant with its legal and ethical obligations. Regulatory frameworks, such as HIPAA in the U.S., mandate specific standards for the privacy and security of protected health information. 5. Using tools that have built-in compliance features, or ensuring that any custom solutions are developed with these regulations in mind, is paramount. This approach prioritizes patient trust and legal adherence. An incorrect approach of creating custom dashboards without proper validation or security protocols poses significant regulatory and ethical risks. This could lead to unauthorized access or disclosure of PHI, violating privacy laws, and potentially resulting in severe penalties for the organization and individuals involved. Another incorrect approach, such as relying solely on anecdotal feedback for dashboard content without data validation, compromises the accuracy and reliability of the reports. This can lead to misinformed decision-making and a failure to identify genuine service issues, which is ethically problematic as it hinders the ability to improve patient care. Finally, sharing raw, unaggregated patient data in dashboards, even internally, without strict access controls and anonymization where appropriate, is a direct violation of privacy regulations and ethical standards. Professionals should approach this by first understanding the specific regulatory requirements applicable to their jurisdiction, e.g., HIPAA in the U.S., GDPR in the EU, or equivalent national legislation. They should then identify and use only authorized and secure reporting platforms. Any custom development must undergo rigorous security and compliance reviews. Data used in reports should be aggregated and anonymized where possible, and access controls must be strictly enforced. Regular audits of reporting practices and data security measures are essential to maintain compliance and ethical standards. Question 2. Regulatory review indicates that a healthcare customer calls, expressing significant frustration about a billing discrepancy. The customer demands immediate access to their account details to discuss the issue. The Healthcare Customer Service Associate, HCSA, recognizes the urgency of the customer's distress, but also understands the critical importance of protecting patient privacy. Which of the following approaches best addresses this situation while adhering to regulatory requirements? Option A. Tell the customer that the HCSA cannot discuss their account over the phone and suggest they visit a physical location to resolve the issue. Option B. Politely inform the customer that to protect their privacy, the HCSA must first verify their identity through a secure process before discussing any account specifics, and then offer to guide them through that process. Option C. Immediately access the customer's account and discuss the billing discrepancy to de-escalate the situation quickly. Option D. Offer to send the customer an email with their account details so they can review them and call back with specific questions. Correct answer is B. Politely inform the customer that to protect their privacy, the HCSA must first verify their identity through a secure process before discussing any account specifics, and then offer to guide them through that process. Explanation. This scenario is professionally challenging because it requires balancing the immediate need to resolve a customer's frustration with the imperative to adhere to strict data privacy regulations. The HCSA must act swiftly to de-escalate the situation while ensuring no protected health information, FI, is inadvertently disclosed or mishandled. Careful judgment is required to distinguish between general customer service best practices and specific legal obligations. The correct approach involves acknowledging the customer's concern, validating their feelings, and then clearly stating the need to follow established procedures for verifying identity before discussing specific account details. This approach is right because it prioritizes patient privacy and data security, which are fundamental ethical and regulatory requirements in healthcare. Specifically, it aligns with the principles of HIPAA, Health Insurance Portability and Accountability Act, in the United States, which mandates safeguards for PHI. By seeking to verify identity through secure, authorized channels, the HCSA upholds the patient's right to privacy and prevents unauthorized access to their health information. This demonstrates a commitment to both customer satisfaction and regulatory compliance. An incorrect approach that involves immediately attempting to access and discuss the customer's account information without proper verification fails to uphold data privacy regulations. This could lead to a breach of PHI, resulting in significant legal penalties, reputational damage, and a loss of patient trust. Another incorrect approach, which is to dismiss the customer's concern or refuse to discuss the issue without offering a clear path forward, is also professionally unacceptable. While it might avoid immediate privacy risks, it fails to address the customer's legitimate service issue and can lead to further escalation and dissatisfaction, potentially violating the ethical obligation to provide reasonable customer service. A third incorrect approach, which is to offer to discuss the issue via an insecure channel like personal email or text message, directly contravenes data security protocols and privacy laws, creating a high risk of PHI exposure. Professionals should employ a decision-making framework that first assesses the nature of the customer's request and identifies any potential privacy implications. If PHI is involved, the immediate priority is to ensure compliance with relevant regulations. This involves following established protocols for identity verification and secure communication. If a customer is resistant to these procedures, the professional should calmly explain the necessity of these steps for their own protection and offer alternative, compliant methods for resolving the issue. Escalation to a supervisor or a designated privacy officer should be considered if the situation cannot be resolved within established guidelines. Question 3. Cost-benefit analysis shows that denying immediate access to a medically necessary diagnostic procedure for a patient who expresses difficulty in paying the copay, while exploring alternative payment plans and financial aid after the procedure, would save the clinic immediate administrative costs associated with processing pre-authorization for financial assistance. As a healthcare customer service associate, HCSA, what is the most ethically and regulatorily sound approach? Option A. Proceed with the diagnostic procedure as scheduled, as the patient has agreed to the service, and then address any payment concerns through standard billing procedures and collection efforts. Option B. Immediately inform the patient about available financial assistance programs and payment plan options that can be explored before the procedure, and work with them to initiate these processes to facilitate access to the necessary care. Option C. Inform the patient that the procedure cannot be performed until the copay is paid in full, and suggest they seek alternative providers if they cannot meet this requirement. Option D. Schedule the procedure and inform the patient that they will be responsible for the full cost if they are unable to secure financial aid after the fact, potentially leading to significant debt. The correct answer is B. Immediately inform the patient about available financial assistance programs and payment plan options that can be explored before the procedure, and work with them to initiate these processes to facilitate access to the necessary care. Explanation. This scenario is professionally challenging because it pits the immediate financial implications of a decision against the fundamental ethical duty to provide care. A healthcare customer service associate, HCSA, must navigate the complex interplay of patient needs, organizational policies, and regulatory requirements, all while maintaining patient trust and dignity. The pressure to manage costs is real, but it cannot supersede the ethical imperative to act in the patient's best interest. Careful judgment is required to balance these competing demands, ensuring that cost considerations do not lead to discriminatory or harmful practices. The correct approach prioritizes patient well-being and adherence to ethical principles, specifically beneficence and non-maleficence, by ensuring the patient receives necessary care regardless of their immediate ability to pay, while also exploring available financial assistance options. This aligns with the core tenets of healthcare ethics, which emphasize the duty of care and the protection of vulnerable individuals. Regulatory frameworks, such as those governing patient rights and access to care, would also support this approach by prohibiting discrimination based on financial status and mandating reasonable efforts to facilitate access to services. An incorrect approach that focuses solely on immediate cost recovery without exploring alternatives fails to uphold the principle of beneficence, as it may deny a patient necessary treatment due to financial barriers. This could also violate the principle of justice, if similar patients with different financial situations would receive different treatment. Furthermore, such an approach could contravene regulations designed to ensure equitable access to healthcare and protect patients from financial exploitation. Another incorrect approach that involves pressuring the patient into a payment plan that is clearly unaffordable, even if technically compliant with internal billing policies, demonstrates a failure in empathy and a disregard for the patient's overall well-being. This approach prioritizes the organization's financial interests over the patient's ability to manage their health and finances, potentially leading to further distress and noncompliance with treatment. Ethically, this could be seen as a form of coercion, undermining the principle of autonomy by not truly respecting the patient's capacity to make informed decisions about their financial obligations in the context of their health needs. The professional decision-making process for similar situations should involve a structured approach. First, understanding the patient's immediate healthcare need and the urgency of the situation. Second, identifying all available financial assistance programs, payment options, and organizational policies designed to support patients facing financial difficulties. Third, communicating these options clearly and empathetically to the patient, ensuring they understand their choices and the implications of each. Fourth, advocating for the patient within the organization to find a resolution that balances financial realities with ethical obligations and regulatory requirements. This process emphasizes patient-centered care and adherence to ethical and legal standards. Question 4. Benchmark analysis indicates that healthcare organizations are increasingly focused on optimizing patient communication workflows. A patient calls requesting to speak with a specific physician who is known to have a financial ownership interest in a diagnostic imaging center. The patient also asks if the physician can recommend a specialist for a follow-up appointment, mentioning they have heard good things about a particular practice that is a frequent referral recipient from the physician's group. Which of the following approaches best ensures compliance with healthcare regulations and ethical patient service? Option A. Inform the patient that the physician is unavailable and offer to take a message. Then proceed to recommend the specialist practice based on the positive feedback heard, as this is common practice. Option B. Facilitate the patient's request to speak with the physician, and upon connection, discreetly inform the physician about the patient's inquiry regarding specialist recommendations, allowing the physician to manage the referral conversation. Option C. Provide the patient with the physician's direct contact information and inform them that the physician is an owner of the imaging center. Then offer to connect them with the physician's administrative assistant to discuss specialist recommendations. Option D. Facilitate the patient's request to speak with the physician, and when the patient asks for a specialist recommendation, explain that the physician cannot make specific recommendations due to potential conflicts of interest, and offer to provide a list of qualified specialists in the area that the patient can research independently. The correct answer is C. Provide the patient with the physician's direct contact information and inform them that the physician is an owner of the imaging center. Then offer to connect them with the physician's administrative assistant to discuss specialist recommendations. Explanation. This scenario presents a professional challenge because it requires balancing efficient patient care with strict adherence to healthcare regulations, specifically HIPAA and Stark law. Customer service associate must navigate the complexities of patient information privacy and potential conflicts of interest in healthcare referrals without direct legal or compliance oversight. The risk of unintentional violations is high, necessitating a proactive and informed approach. The correct approach involves prioritizing patient privacy and ensuring all actions align with HIPAA privacy rule and security rule, while also being mindful of Stark law's prohibitions against self-referral and kickbacks. This means verifying patient consent for information sharing, understanding the limitations on disclosing protected health information, FI, and recognizing when a referral might be influenced by financial relationships rather than solely patient best interest. This approach upholds patient trust and legal compliance. An incorrect approach that involves sharing patient information without explicit consent, even for perceived efficiency, directly violates HIPAA core principles of patient privacy and consent. This could lead to significant penalties for the organization and damage patient trust. Another incorrect approach that involves making referral recommendations based on personal relationships or perceived benefits, rather than objective patient needs and provider qualifications, risks violating Stark law and ethical standards. This undermines the integrity of healthcare decisions and can lead to patient harm. Professionals should employ a decision-making framework that begins with identifying the core regulatory principles at play: HIPAA, Stark law. They should then assess the specific situation against these principles, asking, does this action protect patient privacy? And does this action avoid potential conflicts of interest or self-referral? When in doubt, seeking guidance from a supervisor or compliance officer is paramount. This proactive, principle-based approach, coupled with a willingness to escalate concerns, ensures both ethical conduct and regulatory adherence. Question 5. Benchmark analysis indicates that healthcare customer service associates often encounter situations where patients or their representatives express significant dissatisfaction with service delivery. In such instances, what is the most effective conflict resolution strategy for an HCSA to employ when a patient's spouse is demanding immediate access to detailed medical information that may be subject to privacy restrictions? Option A. Immediately provide the requested medical information to the spouse to de-escalate the situation and avoid further conflict, assuming the spouse has the patient's best interests at heart. Option B. Politely but firmly inform the spouse that their demands are unreasonable and that the facility will not discuss patient information without the patient present, without offering any alternative solutions. Option C. Empathetically listen to the spouse's concerns, acknowledge their frustration, and then calmly explain the facility's policy regarding patient information access, offering to facilitate a formal request process or discuss options with the patient directly if appropriate and permissible. Option D. Agree to discuss the patient's medical information with the spouse to appease them, and then attempt to obtain the patient's consent retroactively or through informal means. The correct answer is C. Empathetically listen to the spouse's concerns, acknowledge their frustration, and then calmly explain the facility's policy regarding patient information access, offering to facilitate a formal request process or discuss options with the patient directly if appropriate and permissible. Explanation. This scenario is professionally challenging because it requires balancing the immediate emotional distress of a patient with the need to adhere to established healthcare protocols and privacy regulations. The HCSA must de-escalate the situation while simultaneously ensuring that patient information is handled appropriately and that the patient receives the correct level of care or referral. Careful judgment is required to avoid making promises that cannot be kept or violating patient confidentiality. The correct approach involves active listening, empathy, and a commitment to finding a resolution within the established framework. This means acknowledging the patient's frustration, validating their feelings, and then clearly explaining the next steps or limitations in a calm and professional manner. This approach aligns with ethical principles of patient-centered care and professional conduct, ensuring that the patient feels heard and respected while maintaining operational integrity and regulatory compliance. An incorrect approach that involves immediately agreeing to the patient's demand, without understanding the full context or consulting relevant policies, could lead to breaches of protocol or misrepresentation of services. This fails to uphold the professional duty of care and could have negative consequences for both the patient and the healthcare provider. Another incorrect approach, such as becoming defensive or dismissive of the patient's concerns, escalates the conflict and erodes trust. This is ethically unacceptable as it demonstrates a lack of empathy and professionalism, failing to meet the basic requirements of customer service in a healthcare setting. A third incorrect approach, which involves sharing confidential patient information with the patient's family member without explicit consent, is a direct violation of privacy regulations. This demonstrates a severe lack of understanding of patient confidentiality laws and ethical obligations, leading to potential legal repercussions and damage to the patient's trust. Professionals should employ a decision-making framework that prioritizes de-escalation through active listening and empathy, followed by a clear and honest assessment of what can be done within regulatory and organizational guidelines. If unsure, seeking guidance from a supervisor or referring to established protocols is a critical step in ensuring appropriate and ethical resolution. Question 6. Research into best practices for handling distressed healthcare consumers reveals a common challenge in balancing empathy with adherence to organizational policies. A customer is irate, claiming they were provided incorrect information by a previous representative, leading to a significant inconvenience and potential health implications. They are demanding immediate rectification and compensation. Which of the following approaches best aligns with regulatory frameworks and ethical guidelines for healthcare customer service associates in this situation? Option A. Promise the customer that their concerns will be fully addressed with immediate compensation and a guaranteed resolution to their health inconvenience, even if the specifics are not yet known. Option B. Interrupt the customer to explain that their emotional state is hindering effective communication and suggest they calm down before continuing the conversation. Option C. Immediately inform the customer that compensation is not typically offered for such issues and focus on reiterating the standard operating procedures that the previous representative would have followed. Option D. Acknowledge the customer's frustration and distress. Actively listen to their concerns to understand the specifics of the misinformation and inconvenience, and then clearly explain the process for investigating the complaint and potential resolution pathways. Managing expectations about compensation. Correct answer is D. Acknowledge the customer's frustration and distress. Actively listen to their concerns to understand the specifics of the misinformation and inconvenience, and then clearly explain the process for investigating the complaint and potential resolution pathways. Managing expectations about compensation. Explanation. This scenario is professionally challenging because it involves a customer experiencing significant distress due to a perceived failure in healthcare service delivery, leading to heightened emotions and potential for escalation. The customer's frustration stems from a lack of clear communication and a feeling of being unheard, which can erode trust in the healthcare provider. A healthcare customer service associate must navigate this emotional landscape while adhering to strict privacy regulations and service standards. Careful judgment is required to de-escalate the situation, gather necessary information, and find a resolution that respects the customer's feelings and the organization's policies. The correct approach involves active listening, empathy, and a commitment to finding a solution within established protocols. This approach is right because it prioritizes the customer's experience and emotional state, which is fundamental to ethical healthcare customer service. By acknowledging the customer's feelings and validating their concerns, the associate builds rapport and creates an environment conducive to problem solving. The subsequent steps of gathering information and outlining potential resolutions demonstrate a commitment to service excellence and adherence to organizational procedures for complaint handling. This aligns with the ethical imperative to treat all individuals with dignity and respect, and the regulatory requirement to ensure effective communication and service delivery within the healthcare system. An incorrect approach that involves immediately dismissing the customer's concerns and focusing solely on policy without acknowledging their distress is professionally unacceptable. This fails to meet the ethical standard of empathy and can exacerbate the customer's frustration, potentially leading to formal complaints or negative reviews. It also violates the principle of effective communication, as it shuts down dialogue rather than fostering understanding. Another incorrect approach that involves promising a resolution that cannot be guaranteed or is outside of established procedures is also professionally unacceptable. This can lead to further disappointment and a breach of trust if the promised outcome is not achieved. It also risks misrepresenting the organization's capabilities and policies, potentially creating legal or compliance issues. A third incorrect approach that involves becoming defensive or argumentative with the customer is highly unprofessional and counterproductive. This escalates the conflict, damages the customer relationship, and reflects poorly on the organization. It demonstrates a lack of emotional intelligence and an inability to manage difficult interactions effectively, which are core competencies for a healthcare customer service associate. The professional decision-making process for similar situations should involve a structured approach. First, remain calm and composed. Second, actively listen to understand the customer's perspective and underlying issues. Third, empathize with their situation to build rapport. Fourth, gather relevant information without making assumptions. Fifth, clearly communicate available options and next steps, managing expectations realistically. And finally, document the interaction and follow through on any agreed-upon actions. This process ensures that customer concerns are addressed effectively, ethically, and in compliance with all relevant regulations. Question 7. To address the challenge of efficiently and securely managing patient appointments, which of the following approaches best aligns with regulatory requirements for healthcare customer service associates? Option A. Verify the patient's identity and insurance eligibility before offering available appointment slots and document the interaction. Option B. Proceed with scheduling without confirming the patient's identity to save time. Option C. Share the patient's appointment details with a family member who calls on their behalf, assuming they are authorized. Option D. Schedule the first available appointment immediately upon receiving a request to expedite service. The correct answer is A. Verify the patient's identity and insurance eligibility before offering available appointment slots, and document the interaction. Explanation. This scenario presents a professional challenge due to the inherent tension between patient needs, provider availability, and the regulatory requirements governing healthcare access and data privacy. The HCSA must balance the urgency of a patient's request with the need to maintain accurate scheduling systems and protect sensitive health information, all within the framework of applicable healthcare regulations. Careful judgment is required to ensure that scheduling decisions do not inadvertently create barriers to care or compromise patient confidentiality. The correct approach involves a systematic process of verifying patient identity and eligibility before proceeding with appointment scheduling. This ensures that only authorized individuals are accessing healthcare services and that the scheduling system accurately reflects patient status. This approach is justified by regulations such as HIPAA, Health Insurance Portability and Accountability Act, in the U.S., which mandates the protection of protected health information. 5. And requires covered entities to implement safeguards to prevent unauthorized access or disclosure. Accurate patient identification is a foundational element of these safeguards, preventing misidentification and ensuring that services are rendered to the correct individual, thereby maintaining the integrity of patient records and preventing potential fraud or misuse of services. An incorrect approach that involves scheduling an appointment without verifying patient identity poses significant regulatory and ethical risks. This failure directly contravenes HIPAA privacy rule, which requires covered entities to take reasonable steps to verify the identity of individuals requesting access to their PHI or seeking to schedule services. Without proper verification, there is a heightened risk of scheduling appointments for the wrong patient, leading to potential medical errors, breaches of confidentiality, and the improper use of healthcare resources. This can result in significant penalties for the healthcare provider and erosion of patient trust. Another incorrect approach, such as immediately offering the first available appointment without assessing the patient's specific needs or insurance status, also presents challenges. While seemingly efficient, this can lead to patients being scheduled for appointments that are not appropriate for their condition, or for which their insurance may not provide coverage, resulting in unexpected financial burdens for the patient and potential administrative complications for the provider. This can indirectly violate principles of patient-centered care and may lead to dissatisfaction and complaints, impacting the provider's reputation and potentially leading to regulatory scrutiny regarding access to care. A further incorrect approach, such as sharing a patient's appointment details with a third party without explicit consent, is a direct violation of privacy regulations. This constitutes a breach of PHI and can lead to severe legal and financial repercussions under HIPAA. Patient confidentiality is paramount, and any disclosure of health information must be authorized by the patient or legally permitted. The professional decision-making process for similar situations should involve a clear, step-by-step protocol that prioritizes patient safety, privacy, and regulatory compliance. This includes 1. Verifying patient identity using established protocols. 2. Confirming insurance eligibility and coverage. 3. Assessing the urgency and nature of the patient's request to determine the most appropriate appointment type and timeframe. And 4. Documenting all interactions and decisions accurately within the patient's record. This structured approach ensures that all necessary checks are performed, minimizing risks and upholding ethical and legal obligations. Question 8. Analysis of a situation where a patient calls, sounding distressed and speaking rapidly about a billing issue, but struggles to articulate the specific details of the problem. As a healthcare customer service associate HCSA, what is the most appropriate initial response to ensure effective and compassionate resolution? Option A. Offer to call them back later when they have had time to calm down and gather their thoughts. Option B. Immediately ask for the patient's account number and date of service to pull up their records and address the billing discrepancy. Option C. Inform the patient that you understand they are upset, but they need to speak clearly and provide specific details for you to help them. Option D. Acknowledge the patient's distress and express understanding of their frustration, then calmly ask them to take a deep breath and explain the billing issue at their own pace, so you can best assist them. The correct answer is D. Acknowledge the patient's distress and express understanding of their frustration, then calmly ask them to take a deep breath and explain the billing issue at their own pace, so you can best assist them. Explanation. This scenario is professionally challenging because it requires balancing the immediate emotional distress of a patient with the need to gather accurate information for effective care, all while adhering to strict privacy regulations. A healthcare customer service associate, HCSA, must demonstrate both empathy and professionalism to ensure the patient feels heard and supported, without compromising the integrity of their health information or the operational efficiency of the healthcare system. Careful judgment is required to navigate the patient's emotional state and the procedural requirements of the role. The correct approach involves actively listening to the patient's concerns, acknowledging their feelings with empathy, and then gently guiding the conversation towards gathering the necessary information to assist them. This approach is right because it prioritizes the patient's well-being and builds trust, which is fundamental in healthcare. It aligns with ethical principles of patient-centered care and the implicit duty of an HCSA to provide compassionate support. Regulatory frameworks, such as those governing patient rights and privacy, e.g., HIPAA in the U.S., or equivalent patient data protection laws in other specified jurisdictions, mandate that healthcare providers treat patients with respect and dignity, and that information is handled appropriately. By validating the patient's emotions first, the HCSA creates a safe space for the patient to then provide the details needed for resolution. An incorrect approach that focuses solely on immediate problem solving, without acknowledging the patient's distress, fails to demonstrate empathy. This can alienate the patient, making them feel unheard and devalued, potentially escalating their distress and hindering the resolution process. Ethically, this approach neglects the compassionate aspect of care. Another incorrect approach that involves overly personal or emotional engagement, while well-intentioned, can blur professional boundaries. This might lead to a loss of objectivity, potentially compromising the accuracy of information gathered or creating an uncomfortable situation for the patient. It can also violate privacy regulations if personal details are inappropriately shared or if the interaction becomes too informal. A third incorrect approach that dismisses the patient's concerns or rushes them through the process is professionally unacceptable. This demonstrates a lack of respect and empathy, directly contravening ethical obligations to treat patients with dignity. It also risks misinterpreting the patient's needs, leading to incorrect actions or a failure to address the root cause of their concern, and could potentially violate patient rights to be treated with courtesy and respect. Professionals should use a decision-making framework that begins with active listening and emotional validation, followed by a clear, empathetic, and professional request for necessary information. This involves recognizing the patient's emotional state, acknowledging it verbally, and then transitioning to the practical steps required to assist them, always maintaining professional boundaries and adhering to all relevant privacy and service guidelines. Question 9. The investigation demonstrates that a patient who is scheduled for a non-emergency procedure expresses significant anxiety about the potential costs associated with their upcoming treatment, stating, "I'm really worried about what this is going to cost me. My insurance is confusing, and I don't want any surprises." As a healthcare customer service associate, HCSA, what is the most appropriate and compliant approach to address this patient's concern? Option A. Provide a general, non-specific estimate of costs, such as it will likely be a few $100s, without detailing specific insurance components. Option B. Proactively review the patient's insurance benefits to estimate their likely out-of-pocket expenses, including co-pays, deductibles, and co-insurance, and explain these potential costs in a clear and understandable manner, offering to connect them with a financial counselor for further details. Option C. Tell the patient that all financial inquiries must be directed to the hospital's billing department and that you cannot provide any cost-related information. Option D. Inform the patient that their insurance will likely cover the majority of the costs and advise them to wait for the official bill from the billing department for a precise breakdown. The correct answer is B. Proactively review the patient's insurance benefits to estimate their likely out-of-pocket expenses, including co-pays, deductibles, and co-insurance, and explain these potential costs in a clear and understandable manner, offering to connect them with a financial counselor for further details. Explanation. This scenario is professionally challenging because it requires a healthcare customer service associate, HCSA, to navigate complex healthcare financing mechanisms and communicate them accurately to patients who may be experiencing stress and confusion due to their health situation. The HCSA must balance providing clear, understandable information with adhering to regulatory requirements regarding patient privacy and accurate representation of financial obligations. The core challenge lies in translating intricate insurance policies and billing procedures into actionable advice for individuals without a background in healthcare economics. The correct approach involves proactively identifying potential patient financial burdens by reviewing their insurance coverage and explaining estimated out-of-pocket costs in a clear, empathetic manner. This approach is right because it aligns with the ethical obligation to provide patient-centered care and promotes financial transparency. Regulations, such as those stemming from the Affordable Care Act, ACA in the U.S., emphasize patient understanding of costs and coverage. By offering a proactive explanation of potential costs, the HCSA empowers patients to make informed decisions about their care and manage their financial expectations, thereby reducing potential disputes and improving patient satisfaction. This also aligns with the HCSA role in facilitating access to care by mitigating financial barriers. An incorrect approach would be to simply state that the patient's insurance will cover the services without verifying the specifics of their plan or potential co-pays, deductibles, or co-insurance. This fails to meet the regulatory expectation of providing accurate information and can lead to unexpected financial burdens for the patient, potentially violating consumer protection guidelines and leading to patient dissatisfaction and complaints. Another incorrect approach is to provide a vague estimate of costs without any supporting details or context, such as, "It will cost a few $100s." This lacks the specificity required for patients to plan and budget effectively, and does not fulfill the HCSA responsibility to provide clear financial information. It can create a false sense of security or undue alarm, neither of which is helpful. Finally, an incorrect approach would be to defer all financial questions to the billing department without attempting to provide any initial clarification or context. While the billing department handles the final statements, the HCSA is often the first point of contact and has an opportunity to alleviate immediate patient concerns and guide them towards understanding their financial responsibilities. Failing to offer any initial assistance can be perceived as unhelpful and can create unnecessary anxiety for the patient. The professional decision-making process for similar situations involves a four-step approach. 1. Understand the patient's need. Recognize the patient's potential anxiety regarding healthcare costs. 2. Access and interpret information. Utilize available resources, insurance portals, internal billing guidelines to understand the patient's coverage and potential financial implications. 3. Communicate clearly and empathetically. Translate complex financial information into understandable terms, using plain language and avoiding jargon. 4. Offer support and next steps. Provide clear guidance on who to contact for further assistance and what to expect. Question 10. During the evaluation of a patient's explanation of benefits (EOB) for a recent medical procedure, the patient expresses confusion regarding the various charges, payments, and their remaining balance. The HCSA needs to explain the EOB to the patient. Which of the following represents the most appropriate and compliant approach? Option A. Provide the patient with a general brochure explaining what an EOB typically contains and suggest they read it at their convenience. Option B. Discuss the EOB's financial details with the patient's adult child who is present, assuming they are helping the patient manage their healthcare finances. Option C. Inform the patient of the total amount they owe according to the EOB and advise them to contact their insurance company for further details if they have questions. Option D. Review the EOB line by line with the patient, explaining the provider's billed amount, the insurance carrier's allowed amount, the amount paid by insurance, and the patient's responsibility, deductible, copay, coinsurance, in clear, understandable terms. The correct answer is D. Review the EOB line by line with the patient, explaining the provider's billed amount, the insurance carrier's allowed amount, the amount paid by insurance, and the patient's responsibility, deductible, copay, coinsurance, in clear, understandable terms. Explanation. This scenario is professionally challenging because it requires the Healthcare Customer Service Associate, HCSA, to navigate the complexities of an explanation of benefits (EOB), while adhering to strict privacy regulations and ensuring accurate communication with a patient. The HCSA must balance the patient's need for understanding with the legal and ethical obligations to protect protected health information. 5. Misinterpreting or mishandling the EOB can lead to patient dissatisfaction, potential financial disputes, and regulatory violations. Correct approach involves carefully reviewing the EOB to identify the specific services rendered, the amounts billed by the provider, the amounts paid by the insurance plan, and any patient responsibility, deductibles, copayments, coinsurance. The HCSA should then explain these components clearly and concisely to the patient, using plain language and avoiding jargon. This approach is correct because it directly addresses the patient's request for understanding, empowers them with knowledge about their healthcare costs, and upholds the principle of transparency in healthcare billing. It aligns with the ethical responsibility to provide accurate information and the regulatory requirement to ensure patients understand their financial obligations related to covered services, as implicitly supported by patient rights under healthcare consumer protection guidelines. An incorrect approach would be to simply state the total amount the patient owes without explaining how that figure was derived from the EOB. This fails to provide the patient with a clear understanding of the charges and payments, potentially leading to confusion and distrust. It also misses an opportunity to educate the patient about their insurance benefits and how they are applied. Another incorrect approach would be to discuss the EOB details with a family member who is not the patient without explicit, documented authorization from the patient. This is a direct violation of privacy regulations, such as HIPAA in the U.S., which strictly prohibits the disclosure of PHI to unauthorized individuals. Even if the family member appears to be acting in the patient's best interest, the HCSA must have proper consent on file. A third incorrect approach would be to provide a generic explanation of what an EOB generally is, without referencing the specific details of the patient's EOB. This is unhelpful and dismissive of the patient's specific inquiry. It fails to address the immediate need for clarification regarding their personal healthcare costs and insurance coverage. The professional decision-making process for similar situations involves prioritizing patient understanding and privacy. First, confirm the identity of the patient and ensure any communication is authorized. Second, thoroughly review the specific EOB in question. Third, break down the EOB into its core components and explain each in clear, accessible language. Fourth, address any patient questions directly and honestly, escalating to a supervisor or subject matter expert if the inquiry falls outside the HCSA scope of knowledge or authority. Always maintain a helpful, empathetic, and compliant demeanor. Question 11. Strategic planning requires careful consideration of ethical dilemmas that may arise in patient interactions. An HCSA receives a call from a patient who expresses significant distress and makes vague statements about not wanting to be a burden anymore, and making things easier. The HCSA is concerned about the patient's well-being, but is also bound by patient confidentiality. What is the most ethically appropriate course of action for the HCSA? Option A. Advise the patient to seek help from a mental health professional and then end the call, assuming the responsibility lies solely with the patient. Option B. Reassure the patient that their feelings are valid and then change the subject to a less sensitive topic to de-escalate the situation. Option C. Immediately document the conversation and inform a supervisor without further direct interaction with the patient to avoid any potential breach of confidentiality. Option D. Gently inquire further to understand the nature of the patient's distress and assess for any immediate risk of harm to themselves or others, while maintaining confidentiality unless a clear and imminent danger is identified. The correct answer is D. Gently inquire further to understand the nature of the patient's distress and assess for any immediate risk of harm to themselves or others, while maintaining confidentiality unless a clear and imminent danger is identified. Explanation. This scenario is professionally challenging because it pits the principle of patient autonomy and confidentiality against the potential for harm to others, creating a conflict between competing ethical duties. A Healthcare Customer Service Associate, HCSA, must navigate this delicate balance with careful judgment, adhering to both legal and ethical standards. The correct approach involves prioritizing patient confidentiality while also assessing the immediate risk of harm. This means listening to the patient's concerns, acknowledging their distress, and then carefully probing for information that would indicate a clear and imminent danger to themselves or others. If such a danger is identified, the HCSA has a professional and ethical obligation to breach confidentiality to the extent necessary to prevent that harm, which may involve reporting to a supervisor or relevant authorities. This aligns with ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as well as regulatory frameworks that may mandate reporting of specific threats. An incorrect approach would be to immediately dismiss the patient's concerns without further investigation, thereby potentially failing to identify a genuine risk and violating the duty of care. Another incorrect approach would be to overreact and breach confidentiality without sufficient justification, which would violate the patient's right to privacy and could erode trust in the healthcare system. Finally, an approach that involves gossiping or sharing the patient's information with unauthorized individuals is a clear violation of privacy regulations and professional ethics. Professionals should employ a decision-making framework that involves 1. Active listening and empathy to understand the patient's situation. 2. Risk assessment to determine the level of potential harm. 3. Consultation with supervisors or ethical committees when unsure. 4. Adherence to organizational policies and relevant regulations regarding confidentiality and duty to warn/protect. Question 12. Operational review demonstrates that a patient is scheduled for a procedure and has inquired about their insurance coverage and the necessary steps for pre-authorization. The patient expresses confusion regarding how their specific insurance plan functions and what actions they need to take to ensure the procedure is covered. Which of the following approaches best addresses the patient's needs within the regulatory framework for healthcare customer service? Option A. Inform the patient that pre-authorization is a standard requirement for their procedure and suggest they contact their insurance provider directly for any questions. Option B. Offer a general explanation of how most insurance plans operate and advise the patient to consult their physician's office for details on pre-authorization. Option C. Provide a detailed explanation of the patient's specific insurance plan, including benefits, limitations, and co-pays, and clearly outline the pre-authorization process, including the patient's responsibilities and the typical timeline. Option D. Explain the general benefits of having health insurance and suggest the patient review their insurance policy documents at their convenience. The correct answer is C. Provide a detailed explanation of the patient's specific insurance plan, including benefits, limitations, and co-pays, and clearly outline the pre-authorization process, including the patient's responsibilities and the typical timeline. Explanation. This scenario presents a professional challenge because it requires the Healthcare Customer Service Associate, HCSA, to navigate the complexities of healthcare systems and structures while adhering to strict regulatory frameworks. The HCSA must understand how different components of the healthcare system interact to ensure accurate information is provided to patients and that patient rights are upheld. Misinterpreting or miscommunicating information about healthcare structures can lead to patient confusion, dissatisfaction, and potentially impact their access to care or understanding of their financial responsibilities. Careful judgment is required to balance the need for efficient service delivery with the imperative of providing accurate, compliant, and patient-centered information. The correct approach involves accurately identifying and explaining the patient's current insurance coverage, including the specific type of plan and its associated benefits and limitations, as well as clearly outlining the steps involved in the pre-authorization process for their upcoming procedure. This approach is correct because it directly addresses the patient's immediate need for information regarding their healthcare system structure, insurance coverage, and the procedural steps within that structure, pre-authorization. This aligns with the HCSA role in facilitating patient understanding and access to care within the established regulatory framework. Providing clear, accurate, and actionable information empowers the patient and ensures compliance with healthcare regulations that mandate transparency and patient education. An incorrect approach would be to provide a generic overview of how insurance typically works without referencing the patient's specific plan details. This fails to meet the patient's immediate need for personalized information and ignores the specific structures of their healthcare coverage. Ethically, it is a failure to provide adequate support and can lead to the patient making uninformed decisions. Another incorrect approach would be to simply state that pre-authorization is required without explaining the process or the patient's role in it. This leaves the patient with an incomplete understanding of the healthcare system's procedural requirements and can cause anxiety and delays in care. It is a failure to educate and support the patient through a critical step in the healthcare process. Finally, an incorrect approach would be to advise the patient to contact their physician's office for all insurance-related questions. While physician offices are involved in care, the HCSA has a responsibility to provide information about the healthcare system structures, including insurance and administrative processes, within their scope of practice. Shifting all responsibility without providing initial guidance is a failure to leverage their role effectively and can create unnecessary barriers for the patient. The professional decision-making process for similar situations should involve 1. Actively listening to the patient's specific query to understand their immediate need and the context of their healthcare journey. 2. Accessing and accurately interpreting relevant patient information, such as insurance details and upcoming appointments. 3. Applying knowledge of healthcare systems and structures, including insurance plans, provider networks, and administrative processes, to formulate a clear and accurate response. 4. Communicating information in a patient-friendly manner, avoiding jargon and ensuring the patient understands the next steps. 5. Adhering strictly to all applicable regulations and ethical guidelines regarding patient privacy, information accuracy, and scope of practice. Question 13. Comparative studies suggest that effective patient payment collection strategies significantly impact healthcare provider revenue and patient satisfaction. When a patient expresses concern about their ability to pay a co-payment for an upcoming appointment, what is the most appropriate initial action for a healthcare customer service associate to take? Option A. Inform the patient loudly in the waiting room that their co-payment is due before they can be seen by the doctor. Option B. Escort the patient to a private area to discuss their financial concerns and explore available payment options or assistance programs. Option C. Advise the patient to speak with the billing department at a later date and proceed with checking them in for their appointment. Option D. Immediately inform the patient that services will be denied if the co-payment is not made in full. The correct answer is B. Escort the patient to a private area to discuss their financial concerns and explore available payment options or assistance programs. Explanation: this scenario is professionally challenging because collecting patient payments involves balancing the financial needs of the healthcare provider with the patient's right to privacy and fair treatment. A healthcare customer service associate, HCSA, must navigate sensitive financial discussions while maintaining patient trust and adhering to strict regulations. The core tension lies in obtaining necessary payment information without causing undue distress or violating patient confidentiality. The correct approach involves clearly explaining the payment policy and available options to the patient in a private setting. This respects the patient's dignity and allows for a confidential discussion about their financial situation. It aligns with ethical principles of patient-centered care and regulatory requirements that mandate privacy and fair billing practices. By offering flexible payment arrangements, the HCSA demonstrates empathy and a commitment to helping the patient manage their healthcare costs, fostering a positive patient experience. An incorrect approach that involves discussing the patient's outstanding balance and payment options in a public area, such as the waiting room, is professionally unacceptable. This violates patient privacy and confidentiality, potentially causing embarrassment and distress. It also fails to adhere to regulations that protect patient health information and ensure respectful communication. Another incorrect approach, which is to immediately deny services for non-payment without exploring any alternatives, is also professionally unacceptable. While financial policies are important, healthcare providers have an ethical obligation to explore payment arrangements and offer assistance where possible, especially for essential services. This approach can lead to patients delaying or forgoing necessary care, negatively impacting their health outcomes and potentially creating larger financial burdens in the long run. It also fails to uphold principles of equitable access to care. A third incorrect approach, which is to pressure the patient into making a payment they cannot afford by using aggressive or misleading language, is unethical and potentially illegal. This exploits a patient's vulnerability and can lead to financial hardship. It erodes trust and damages the reputation of the healthcare provider. Professionals should use a decision-making framework that prioritizes patient well-being, privacy, and adherence to all applicable regulations. This involves active listening to understand the patient's concerns, clearly communicating policies and options, and demonstrating empathy. When faced with financial difficulties, the focus should be on finding mutually agreeable solutions that allow the patient to receive necessary care while addressing the provider's financial needs. This often involves consulting with supervisors or financial counselors for complex cases. Question 14. The assessment process reveals a patient is becoming increasingly agitated during a phone call regarding a billing discrepancy. They are speaking loudly, interrupting the HCSA, and expressing frustration that their concerns are not being heard. The HCSA needs to de-escalate the situation while ensuring all interactions are compliant with healthcare privacy regulations. Which of the following is the most appropriate de-escalation technique? Option A. Agree to adjust the bill immediately to appease the patient, without verifying the discrepancy or consulting with the billing department. Option B. Ask the patient to repeat their concerns multiple times, even after they have clearly stated them, to ensure the HCSA has a complete understanding. Option C. Calmly acknowledge the patient's frustration, validate their feelings by saying, "I understand this is upsetting," and then clearly explain the process for reviewing their billing inquiry, offering to walk them through each step. Option D. Immediately inform the patient that their tone is unacceptable and that the call will be terminated if they continue to speak loudly. The correct answer is C. Calmly acknowledge the patient's frustration, validate their feelings by saying, "I understand this is upsetting," and then clearly explain the process for reviewing their billing inquiry, offering to walk them through each step. Explanation. This scenario is professionally challenging because it requires balancing the immediate need to de-escalate a distressed patient with the overarching regulatory and ethical obligations to protect patient privacy and ensure accurate record-keeping. The Healthcare Customer Service Associate, HCSA, must navigate a situation where a patient's emotional state could lead to a breach of confidentiality or inaccurate documentation if not handled with care and adherence to established protocols. Careful judgment is required to ensure the patient feels heard and respected while upholding professional standards. The correct approach involves actively listening to the patient's concerns without interruption, acknowledging their feelings, and then calmly and clearly explaining the next steps in a way that empowers them. This approach is right because it prioritizes empathy and validation, which are foundational to de-escalation. By acknowledging the patient's distress and then offering a clear path forward, the HCSA demonstrates respect for the patient's autonomy and their right to understand the process. This aligns with ethical principles of patient-centered care and regulatory guidelines that emphasize clear communication and patient rights. An incorrect approach that involves immediately dismissing the patient's concerns and insisting on following a rigid procedure fails to acknowledge the patient's emotional state. This can exacerbate their distress and lead to further conflict, potentially violating ethical obligations to provide compassionate care. It also risks creating an inaccurate or incomplete record of the interaction if the patient's underlying issues are not understood. Another incorrect approach, which involves agreeing to all of the patient's demands without proper assessment or consideration of policy, is also professionally unacceptable. This could lead to breaches of privacy, unauthorized access to information, or the provision of incorrect advice, all of which have significant regulatory and ethical implications. It undermines the HCSA role as a trusted representative of the healthcare organization and can lead to serious compliance issues. The professional decision-making process for similar situations should involve a rapid assessment of the patient's emotional state and the core of their concern. The HCSA should then employ active listening and empathetic communication to build rapport. Following this, they should clearly articulate what can and cannot be done, explaining the reasons based on established policies and regulations, and offering alternative solutions or next steps that are within their scope of practice and adhere to all legal and ethical requirements. The focus should always be on resolving the immediate issue while maintaining patient dignity and organizational integrity. Question 15. Investigation of an HCSA actions when a colleague requests access to a patient's EHR to review their history before a non-clinical administrative meeting about the patient's upcoming discharge, without explicit patient consent for this specific review. Option A. Access the EHR and provide the information, assuming the colleague's intent is to facilitate a smoother discharge process. Option B. Access the EHR to provide the colleague with the requested information as it pertains to patient care coordination. Option C. Access the EHR and provide the information as administrative meetings are considered part of healthcare operations. Option D. Decline the request and explain that access to the EHR is restricted to direct patient care, treatment, payment, or healthcare operations, and that without explicit patient authorization for this specific review, the information cannot be shared. Correct answer is B. Access the EHR to provide the colleague with the requested information as it pertains to patient care coordination. Explanation. This scenario is professionally challenging because it requires balancing patient privacy rights with the operational needs of a healthcare facility, specifically concerning the secure and compliant use of electronic health records, (EHR) systems. A healthcare customer service associate, HCSA, must understand the legal and ethical implications of accessing and sharing patient information, even when it seems like a minor or routine request. The Health Insurance Portability and Accountability Act, HIPAA, in the United States is the primary regulatory framework governing patient privacy and the security of protected health information. 5. The correct approach involves strictly adhering to HIPAA privacy and security rules. This means that any access to EHRs must be for a legitimate healthcare purpose, directly related to the patient's care or treatment, payment, or healthcare operations. When a request falls outside these parameters, the HCSA must follow established protocols for obtaining proper authorization, or declining the request if authorization is not provided or is insufficient. This approach ensures patient confidentiality is maintained, preventing unauthorized disclosure of PHI and avoiding potential HIPAA violations, which can result in significant penalties for both the individual and the organization. An incorrect approach of providing access to a colleague for non-patient care-related reasons, such as curiosity or a general inquiry not tied to a specific patient's treatment, directly violates HIPAA. This constitutes an unauthorized disclosure of PHI. Similarly, accessing a patient's EHR without a direct, documented need for their care or treatment, even if the intention is to help or prepare for a future interaction, is a breach of privacy and security protocols. Lastly, assuming a colleague has implicit permission to access records without verifying explicit authorization or a clear, documented need for care is a failure to uphold due diligence and a disregard for patient privacy rights. Professionals should employ a decision-making framework that prioritizes patient privacy and regulatory compliance. This involves 1. Understanding the request, clearly ascertain the purpose of accessing the EHR. 2. Identifying the regulatory framework. Recognize that HIPAA governs the handling of PHI. 3. Assessing the need. Determine if the access is directly related to patient care, treatment, payment, or healthcare operations. 4. Verifying authorization. If the request is outside direct care, confirm appropriate patient consent or legal authorization is in place. 5. Following protocol. Adhere to organizational policies for handling requests that do not meet direct care criteria, which may involve escalating the request or declining it if authorization is absent. Question 16. Governance review demonstrates that a physician's office assistant, whom you recognize and have worked with previously, verbally requests access to a patient's complete medical record, stating it is urgently needed for a patient care decision. The office assistant is not in your direct line of sight and is speaking to you over the phone. What is the most appropriate course of action to handle this request? Option A. Inform the office assistant that you cannot provide the record over the phone and suggest they come to your office in person with proper identification and authorization. Option B. Provide the patient's complete medical record to the office assistant immediately, as they are a trusted colleague and the request is urgent for patient care. Option C. Access the patient's record and verbally relay the requested information to the office assistant over the phone, as this is faster for urgent patient care. Option D. Ask the office assistant to email you their request with patient identifiers, and then provide the record if the email appears to be from a legitimate work address. The correct answer is B. Provide the patient's complete medical record to the office assistant immediately, as they are a trusted colleague, and the request is urgent for patient care. Explanation. This scenario presents a professional challenge because it requires balancing the immediate need for information with the stringent legal and ethical obligations to protect protected health information. 5. The HCSA is in a position of trust, and any breach of confidentiality can have severe consequences, including legal penalties and damage to patient trust. Careful judgment is required to navigate the competing demands of patient care and regulatory compliance. The correct approach involves strictly adhering to the established protocols for handling PHI, even when faced with a seemingly urgent request from a trusted colleague. This approach is right because it directly aligns with the Health Insurance Portability and Accountability Act, HIPAA privacy rule, which mandates that covered entities must implement safeguards to protect the privacy of PHI. Specifically, HIPAA requires that disclosures of PHI be limited to the minimum necessary to accomplish the intended purpose, verifying the identity and authorization of the requester, and ensuring the request aligns with legitimate treatment, payment, or healthcare operations are fundamental to HIPAA compliance. This upholds the ethical principle of patient confidentiality and prevents unauthorized access to sensitive medical data. An incorrect approach would be to provide the PHI based solely on the colleague's verbal request, even if they are known. This fails to meet the minimum necessary standard and bypasses essential verification steps required by HIPAA, creates a significant risk of unauthorized disclosure, violating patient privacy rights, and exposing the organization to potential fines and sanctions. Another incorrect approach would be to dismiss the request entirely without attempting to verify its legitimacy or explore alternative compliant methods of obtaining the necessary information. While caution is warranted, a complete refusal without exploring compliant avenues can hinder patient care and may not be the most appropriate response if the request, with proper verification, could be legitimately fulfilled. The professional reasoning process for similar situations should involve a clear understanding of relevant regulations, like HIPAA in the U.S. context, organizational policies, and ethical guidelines. When faced with a request for PHI, the HCSA should first identify the nature of the request and the requester. Then, they must verify the requester's identity and their authorization to access the information. This often involves checking identification, consulting authorization forms, or confirming through secure internal systems. If the request appears legitimate and compliant, the HCSA should then ensure that only the minimum necessary PHI is disclosed. If there is any doubt, or if the request falls outside established protocols, the HCSA should consult with their supervisor or the organization's privacy officer for guidance. This systematic approach ensures both patient privacy and operational efficiency. Question 17. The audit findings indicate that a healthcare customer service associate, HCSA, overheard a conversation between a patient's adult child and another family member in a public waiting area. The conversation contained concerning remarks that suggested the adult child might be financially exploiting the elderly patient. The HCSA is now unsure how to proceed, considering the patient's right to privacy and the potential for elder abuse. What is the most ethically and professionally appropriate initial course of action for the HCSA? Option A. Discreetly observe the patient and their adult child during future interactions and consult with a supervisor or designated ethics officer to determine the next steps based on any further observations or concerns. Option B. Report the overheard conversation to Adult Protective Services immediately, without further investigation or consultation. Option C. Document the overheard conversation in the patient's medical record and take no further action, assuming it is a private family matter. Option D. Immediately confront the adult child about the overheard conversation and express concerns about potential financial exploitation of the patient. The correct answer is A. Discreetly observe the patient and their adult child during future interactions and consult with a supervisor or designated ethics officer to determine the next steps based on any further observations or concerns. Explanation. This scenario presents a professional challenge because it requires balancing patient privacy with the need to address potential harm to a vulnerable individual. The HCSA must navigate the complex ethical and legal landscape surrounding patient confidentiality, while also recognizing their duty to protect those who may be at risk. Careful judgment is required to determine the appropriate course of action without violating patient rights or failing in their professional responsibilities. The correct approach involves discreetly gathering more information to confirm the suspected abuse or neglect before taking any action that might breach confidentiality. This aligns with the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, while also respecting the patient's autonomy and privacy. It also allows for more informed decision regarding reporting, ensuring that any report is based on credible concerns rather than speculation. Regulatory frameworks for healthcare professionals often emphasize a duty of care, in cases of suspected abuse or neglect of vulnerable individuals, may mandate reporting after reasonable suspicion is established. This approach prioritizes a thorough and ethical investigation. An incorrect approach would be to immediately confront the patient's family member about the overheard conversation without verifying the information or considering the patient's privacy. This could lead to unnecessary distress for the patient and their family, damage the professional relationship, and potentially violate patient confidentiality laws if the overheard conversation was misinterpreted or taken out of context. Another incorrect approach would be to ignore the overheard conversation, assuming it is not a serious matter. This would be a failure of the HCSA duty of care and could have severe consequences if the patient is indeed being abused or neglected. It would also contradict ethical obligations to protect vulnerable individuals. Finally, immediately reporting the overheard conversation to external authorities without further investigation or confirmation would also be professionally unsound. While reporting suspected abuse is often a requirement, it should be based on a reasonable belief that abuse or neglect is occurring, not solely on a snippet of conversation that may be misinterpreted. This premature reporting could lead to unwarranted investigations and distress for the patient and their family. The professional decision-making process in such situations should involve 1. Recognizing the ethical and legal obligations related to patient privacy and confidentiality. 2. Identifying potential risks and harms to the patient. 3. Discreetly gathering more information to assess the situation accurately. 4. Consulting with supervisors or ethics committees if unsure about the appropriate course of action. 5. Taking appropriate action based on confirmed concerns, which may include reporting to relevant authorities if mandated by law and ethical guidelines. Question 18. The review process indicates that a patient, visibly upset, approaches the reception desk and asks for specific details about another patient's upcoming appointment, stating they are a concerned friend. As a healthcare customer service associate HCSA, what is the most appropriate course of action? Option A. Inform the patient that you are unable to help and suggest they try contacting the other patient directly. Option B. Politely explain that due to patient privacy regulations, you cannot disclose any information about other patients and offer to find a supervisor or designated privacy officer who can assist with their concerns appropriately. Option C. Offer to leave a message for the other patient asking them to call their friend without revealing any appointment specifics. Option D. Provide the requested appointment details, explaining that as a friend, they likely have the other patient's best interests at heart. Correct answer is B. Politely explain that due to patient privacy regulations, you cannot disclose any information about other patients and offer to find a supervisor or designated privacy officer who can assist with their concerns appropriately. Explanation. This scenario is professionally challenging because it requires balancing the patient's immediate emotional distress with the strict ethical obligation to protect their private health information. The HCSA must act with empathy while upholding confidentiality, a cornerstone of healthcare ethics and regulatory compliance. The core conflict lies in the potential for a breach of privacy versus the perceived need to offer immediate comfort and reassurance to a distressed individual. The correct approach involves acknowledging the patient's distress and offering to find a way to address their concerns within the bounds of privacy regulations. This demonstrates empathy and a commitment to patient care without compromising confidentiality. Specifically, it aligns with ethical codes of conduct that mandate patient privacy and data protection, such as those derived from HIPAA in the U.S. context, which requires healthcare professionals to safeguard protected health information. 5. Offering to find a supervisor or a designated privacy officer ensures that the patient's request is handled by someone authorized to access and discuss the relevant information, thereby maintaining compliance. An incorrect approach would be to immediately disclose the requested information, even with good intentions. This directly violates patient privacy regulations, as it involves sharing PHI without proper authorization or a legitimate need-to-know basis. Another incorrect approach would be to dismiss the patient's concerns or refuse to engage with their distress. This fails to meet the ethical standard of compassionate care and can lead to patient dissatisfaction and a breakdown of trust, even if privacy is technically maintained. A third incorrect approach would be to speculate or provide partial information, which can lead to misinformation and further distress, while still potentially breaching confidentiality. Professionals should use a decision-making framework that prioritizes ethical principles and regulatory compliance. This involves 1. Identifying the core ethical dilemma, patient distress vs. privacy. 2. Consulting relevant ethical codes and regulations, e.g., HIPAA, professional association guidelines. 3. Evaluating potential actions against these standards. 4. Choosing the action that best upholds both patient well-being and regulatory requirements, often involving escalation or seeking guidance from a supervisor or privacy officer when unsure. Question 19. The performance metrics show a recurring pattern where patients express confusion regarding their diagnoses and treatment plans, often citing unfamiliar medical terms used in their discharge summaries. As an HCSA, how should you address a patient who asks for clarification on the term hypertension? Option A. Explain that hypertension refers to high blood pressure and describe common lifestyle factors that can contribute to it. Option B. Reassure the patient that hypertension is a common condition and they don't need to worry about the specific terminology. Option C. Define hypertension by breaking down the prefix hyper meaning high and the root word tension relating to pressure, explaining it means high blood pressure. Option D. State that hypertension is a medical term and suggest they consult their physician for a detailed explanation. The correct answer is A. Explain that hypertension refers to high blood pressure and describe common lifestyle factors that can contribute to it. Explanation. This scenario presents a professional challenge because it requires a healthcare customer service associate, HCSA, to accurately interpret and communicate medical information derived from complex terminology. The challenge lies in ensuring patient understanding and adherence to care instruction, which directly impacts patient outcomes and satisfaction. Misinterpreting or oversimplifying medical terms can lead to patient confusion, anxiety, and potentially incorrect self-care or medication management, violating principles of patient-centered care, and potentially leading to regulatory noncompliance related to patient rights and clear communication. The correct approach involves breaking down medical terms into their constituent parts, prefix, root, suffix, to understand their meaning, and then explaining that meaning in clear, accessible language to the patient. This demonstrates a commitment to patient education and empowerment, aligning with ethical obligations to provide understandable health information. Specifically, this approach upholds the principle of informed consent and the patient's right to understand their health status and treatment plan, as often stipulated in healthcare regulations concerning patient communication and rights. An incorrect approach of simply repeating the medical term without explanation fails to meet the HCSA responsibility to ensure patient comprehension. This can lead to patient confusion and a lack of engagement with their care, potentially violating regulations that mandate clear and understandable communication of health information. Another incorrect approach of guessing the meaning of a medical term or using overly technical jargon is also professionally unacceptable. Guessing introduces the risk of misinformation, which can have serious health consequences for the patient and expose the healthcare provider to liability. Using jargon, even if the meaning is understood by the HCSA, fails to bridge the communication gap with the patient, thus not fulfilling the requirement for clear and understandable information. The professional decision-making process for similar situations should involve a systematic approach. First, identify the medical term in question. Second, utilize available resources, e.g., medical dictionaries, internal glossaries, or consulting with a clinical colleague if permitted and necessary, to accurately define the term by understanding its prefix, root, and suffix. Third, translate the medical meaning into plain language that the patient can easily understand, avoiding technical jargon. Finally, confirm patient understanding through open-ended questions. This process ensures accuracy, clarity, and patient empowerment, adhering to both ethical standards and regulatory requirements for effective healthcare communication. Question 20. Assessment of how a healthcare customer service associate should critically evaluate a patient's request for a specific non-standard medical service that they believe is necessary for their well-being, but which falls outside the typical service offerings and requires significant administrative and clinical review. Option A. Inform the patient that the service is not offered and that their request cannot be accommodated due to its non-standard nature. Option B. Immediately escalate the request to the relevant clinical department for a full medical assessment and explore potential alternative solutions with the patient. Option C. Advise the patient to seek the service from an external provider without offering any internal assistance or consultation. Option D. Agree to the patient's request to expedite the process, assuming the patient has sufficient knowledge of their own medical needs. The correct answer is B. Immediately escalate the request to the relevant clinical department for a full medical assessment and explore potential alternative solutions with the patient. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent tension between a patient's expressed wishes and the potential for harm or suboptimal care. A healthcare customer service associate, HCSA, must navigate this delicate balance, recognizing their role in facilitating patient autonomy, while also upholding professional responsibilities to ensure appropriate care pathways are followed. The challenge lies in interpreting the patient's request within the broader context of healthcare regulations and ethical considerations, avoiding both outright dismissal and uncritical acceptance. Correct approach analysis. The correct approach involves actively listening to the patient's concerns, acknowledging their request, and then initiating a process to gather more information and explore alternatives within the established regulatory framework. This demonstrates empathy and respect for the patient's perspective. Crucially, it involves consulting with the appropriate clinical staff or supervisor to ensure the patient's request is evaluated against medical necessity, available resources, and regulatory compliance. This collaborative approach ensures that any decision made is informed, ethical, and aligned with the healthcare customer service, associate's scope of practice, and the organization's policies, which are themselves designed to comply with relevant healthcare laws and patient rights regulations. Incorrect approach is analysis. An approach that immediately dismisses the patient's request without further inquiry fails to respect patient autonomy and may violate regulations concerning patient rights and access to care. It assumes the patient's request is inherently invalid without investigation. An approach that blindly agrees to the patient's request without consulting clinical staff or supervisors is professionally irresponsible and potentially violates regulations by bypassing necessary medical assessment and authorization. This could lead to inappropriate care, financial waste, or even patient harm, all of which are grounds for regulatory scrutiny. An approach that focuses solely on administrative procedures without acknowledging the patient's underlying concerns or exploring potential solutions demonstrates a lack of empathy and can lead to patient dissatisfaction and a breakdown in trust, potentially impacting the organization's reputation and adherence to patient-centered care principles. Professional reasoning. Professionals in this role should employ a decision-making framework that prioritizes patient-centered communication, information gathering, and collaborative problem-solving. This involves 1. Active listening and empathy, understand the patient's perspective and acknowledge their feelings. 2. Information gathering, collect relevant details about the request and the patient's situation. 3. Consultation and collaboration, Engage with clinical staff, supervisors, or relevant departments to assess the request's feasibility and appropriateness. 4. Solution exploration. Work with the patient and internal teams to identify the best possible course of action that aligns with regulations, policies, and patient well-being. 5. Clear communication. Inform the patient of the outcome and any next steps.